helping people to see that things like electronic medical records aren't just about putting a computer in every doctor's office. They're about using technology to improve care and coordination and safety, and to reduce waste, save dollars, and save lives. And if you've ever doubted how important this is, you won't after you hear from the brave woman who is our next speaker. Please join me in welcoming a woman who has turned her own personal struggle into a tireless crusade for better care, Regina Holliday.
Thank you, Deborah, and thank you to everyone at the National Partnership for inviting me here today. I am an artist, a widow, and the mother of a son with autism. And like all of you, I am an activist for better care. From January to March of 2009, my husband, Regina Holliday, went to his physician a dozen times for pain. He visited 2 ERs with severe pain and was sent home with pain meds each time. After 2 months of this, I demanded a diagnosis. On March 25th, he was hospitalized for tests. On March 27th, the oncologist told my husband while he was alone, he had tumors and growths. The oncologist then left town for 4 days. We had no access to the written record and got a brief verbal summary from the on-call doctors. We were continuously hospitalized in 5 facilities in the last 3 months of Fred's life. Fred suffered a broken hip due to a careless shove during a transfer for radiation, skin breakdown because of inconsistent bedding changes, and avoidable complications because nobody was communicating. No one had all the information they needed to see the whole picture of Fred. This experience was so horrible that I became an advocate for patient access to the electronic medical record. Perhaps our worst experience was his transfer to a new hospital with an incomplete and out-of-date transfer summary. As a result, Fred was denied pain meds and food for 6 hours as the staff tried to cobble together a medical record using a phone and a fax machine. When I had asked for his electronic medical record 6 days earlier, I was told it would cost 73 cents per page, and there would be a 21-day wait. I was astounded. This was a state-of-the-art hospital, yet they were asking us to wait 21 days and spend hundreds of dollars just to see Fred's record. I eventually got a copy, and despite its many errors, it became a virtual Bible that we used to guide Fred's care for the last 56 days of his life. There was not a day I did not reference it, and that information extended Fred's life and helped to create a fragile peace within our hearts. For there is no greater sorrow than watching your loved ones suffer while you feel helpless because you don't have the information to know what is going on, what he needs, or how to help. That is why I work so hard for clarity and transparency in the electronic medical record. I may not be an expert at medicine, but I am an expert on my husband. With access to his medical record, I could explain the treatment options and help ease his mind. When I speak, I am often the only person in the room without a degree after my name. I am glad there are so many educated professionals working on health information technology, but it is also important for patients and caregivers to be heard. Thank you for organizing the Campaign for Better Care to give us a voice. I said when I began, I'm an artist, and I paint images of data. I depict silos and closed data loops, and it happens when patients are left out of the solution. That's one of the ways I speak for Fred. I am his voice, and I hope your voice. We are all patients in the end. We all deserve the right to be treated with dignity and respect. Thank you.